Hi, my name is Dr. Halе Chaglar, a professor of radiation oncology working for Anadolu Medical Center, Radiation Oncology Department. Today I would like to give some information about the radiosurgery and the new CyberKnife M6 system. Radiosurgery, which is so-called stereotactic body radiation therapy or stereotactic ablative radiation therapy, is a technology which gives very high radiation doses to a very focused area and has a sharp dose fall-off with a sharp gradient index and giving very low doses to the surrounding normal tissues. CyberKnife M6 is a dedicated treatment platform to perform radiosurgery, and it is a little bit different from the old version of the CyberKnife. It has been released in 2015, and both the hardware and the software has changed compared with the old version. The general characteristics of the CyberKnife M6 is it's a robot, so it's a robotic dedicated radiosurgery system. And it performs only stereotactic body radiation therapy, but all through parts of the body, beginning from the head to the pelvic area. And the main importance is it can track to the tumor, which is moving with the respiration cycle and other unprepared motions. And the new software of the moving target with the breathing cycle is much more better when we compare it with the older version. The tumor is destroyed directly by killing the tumor cells by hitting its DNA. And stereotactic body radiation therapy gives very high doses. That is the reason we call it ablative doses. So the probability of cell killing with the radiosurgery technology compared with the conventional radiotherapy is much higher. Usually, in order to treat the tumors with the CyberKnife radiosurgery system, the tumors has to be seen. So we need a gross tumor to hit the targets. And majorly compared with the other types of radiation technologies, it has to be relatively smaller. But with the new CyberKnife M6 system, as we have a different hardware called multi-leaf collimators, we can treat bigger tumors compared with the older version. The major advantage of this technology, the radiosurgery technology with the CyberKnife compared with the other treatment platforms and other treatment technologies, the treatment time is short. So the total treatment time is usually 1 week. It's very beneficial for the patients who are living abroad because they can come over, they can have the indication, they can get treated, and they can go home very easily in a short period of time. The CyberKnife radiosurgery system is majorly a non-invasive surgery, but sometimes it could be minimally invasive because in order to hit the target very precisely, we need to see the target. Although the new softwares of the CyberKnife to see the target pretty clearly without having an invasive fiducial marker, sometimes the tumors are located in the areas where it cannot be seen with the CyberKnife system. So with the help of the interventional radiologist, we need to place some fiducials within the target to track the tumors during the treatment time. And this is a major advantage of the CyberKnife compared with the other radiation surgery treatment platforms because it can track the tumor although the tumor is moving with high precision. The average duration of each session is totally depending on the area that we're treating, the closeness of the target to the critical structures, and the total dose that we're giving, but it changes from 15 minutes anywhere to 30 minutes. It's a major advance compared with the older system because the older system was treating every session was treating between 30 minutes to 90 minutes. So the total treatment time the patients spend in the treatment room within one session clearly decrease compared with the older CyberKnife, with the new CyberKnife system. Of course, with any type of treatments, like with any other type of treatments, CyberKnife radiosurgery system has some part of side effects. The side effects are majorly related to the normal tissues that is getting that dose. But as this is a stereotactic approach and we're having a sharp dose full of the dose to the critical structures are not very high, so we are not expecting a lot of quality affecting long-term side effects compared with the other conventional treatment technologies. The Anadolu Medical Center radiation oncology team is very experienced in terms of radiosurgery, not only with CyberKnife M6 but other treatment platforms as well. We are a total of 3 physicians, 3 physicists, 1 dosimetrist and 7 technicians, and we are one of the major CyberKnife training, CyberKnife M6 training centers in Anadolu Medical Center, and just about to sign a contract to be a center of excellence for the Accurate team. So you can come over to our hospital, be treated with CyberKnife M6 for radiosurgery, and go home pretty safe.